A bit of an apology, first of all, no PowerPoint, but being the oldest psychiatrist on staff, I think I'm entitled to do more of a sort of fireside chat type of talk now and again that is your own notes and a little bit of reading material. The title is a little bit of a misnomer. It's more to do with local history of medicine. There's a bit of psychiatry in there and a bit of social medicine, public medicine, but it's actually more history than anything else. Those of you that are new to Argyll and Bute realize that it's a very special, interesting, beautiful area, and I just think that besides the beauty, it's interesting to learn about some of the colourful personalities that used to practice here as doctors, because it's inspirational and it's a reflection of the kind of amazing legacy that we practice in, and it kind of helps us stay motivated, I think, when you can look around, not just at the beauty, but think that some very special people practiced here in years past. And the person I want to fill you in on is a fellow called Lachlan Grant, who for 45 years was the prime GP in Ballahooly. In 2013, NHS Highland commissioned part of a grant, and the idea was to put his archives together, put together a book about his life, which I've got here. And it's very timely because at this point, NHS Highland were, and they still are 2 years later, looking for doctors to fill vacant rural posts. Islands like Cannon, Egg Run that were uncovered, a Caracal, which is still a real challenge, and they've been offering things like golden hellos, £75,000 to attract people to work in these areas because of the on-call and the responsibility. And it's just fascinating that turn the clock back to the 1870s and there were a cohort of very talented people, very motivated, who would in and of themselves take on these challenges single-handedly for, in money terms today, very, very little money. And I think, that's what is so inspirational. So this gentleman was born in 1871. He was in Johnston, just outside Paisley, and his parents were Highlanders. His grandfather, Lachlan, who he's named after, comes from Dingwall, and that's to play a key role in his subsequent choices of where to work. But initially, his dad was a cabinet maker who established a very prominent manufacturing business in Johnston, and it became quite successful. And then he met a woman who was the daughter of the Peyton family. Now, at that time in Johnston, Peyton brothers were the world's biggest manufacturers of boot shoelaces and shoelaces. They made 25 million shoelaces a year and exported them all over the world. So you can imagine the wealth that was coming to the Grant family from that sort of female side of the dynasty. And then his own dad had a very successful cabinet-making business as well. So he was born into a very prosperous, well-heeled family. They were regular churchgoers. They were kind of solid family people, committed Christians, and really they all had life by the tail. And then it all went pear-shaped. In 1878, the Bank of Glasgow collapsed in an absolute scandal, and this was due to corruption within the bank, people squandering money, and an enormous number of Glasgow businesses went belly up just overnight in a flash because all the deposited money vaporized. And these people went from riches to rags just within a matter of days as a result of this bank collapse. And you can imagine the sort of devastation that the family faced. Lachlan was 7 years old when this happened. So fortunately, in comes a sister of his dad's sister, who was a very thrifty grocery business spinster and had saved up quite a bit of money. So she, in a way, came to the rescue of the family, and they ended up purchasing a grocery store in Ballachulish, which had like an upper level flat and a lower level store. And initially the aunt owned it and run it and installed Lachlan's parents as the store managers. And then eventually they took it over when she died. But that was how Lachlan first got his foothold in Ballachulish, which at the time the biggest employer was the slate quarries. And he actually worked as a clerk in the slate quarries as like a sort of gap year job. He was in primary school when he switched to living in Ballachulish. He realized, I mean, the people that taught him realized he was quite the pupil and quite the talent, and rapidly saw that he had amazing potential. So a local reverend took him under his wing, taught him Latin and Greek, and then he went to a private college in Great West Road in Glasgow for university prep, which at that time had to be done privately, and joined Glasgow Uni for an arts faculty course for 2 terms, but then realized that he wanted to do medicine. So he switched, went into Edinburgh University, excelled at just about everything in Edinburgh. He got all kinds of class medals. He got a medal in anatomy, he got a medal in surgery. When he finished in Edinburgh, he obtained his MD thesis on an eye issue 2 years after he graduated, which is quite stupendous, you know, for those days. He buzzed off to Montreal, to the Vic Hospital to learn about psychiatry after he graduated. He went to the States. He was quite sort of forward-thinking and proactive in trying to gather up extra areas of experience. And Argyll Robertson took him under his wing and wanted him to be his protege. And of course we all know about the Argyll Robertson pupil. And Thomas Clouston, who at that time, born in 1840, he had worked in a Cumbria psych hospital as superintendent for 10 years, but then he became the superintendent of the Edinburgh psychiatric hospital in Morningside. And Clouston was very friendly with Lachlan Grant, and in fact was really trying to encourage him to have a career in psychiatry. But in spite of the friendship and Lachlan's talent in that area, he confounded all of the academics in Edinburgh and said, no, I'm off to the Highlands, I'm going to be a GP. So everybody is stunned, but respects the sort of differences of opinion. So from there, he goes to the clinic in Oban and is a medical officer, assistant medical officer in Oban. And in those days, all of those local hospitals were put up by rich benefactors who were entrepreneurs who made their fortune in the Commonwealth, came back to Scotland. So the county hospital in Oban, the Belford in Fort William, and the, what's it called, the Gresh Hospital in the Skye, Gesto Hospital. They all were endowed by rich philanthropists. And the Oban one, about 60 applicants apply for each of these positions as medical officer. So he got the job, did that, enjoyed it for a couple of years, and then switched to a more prestigious job, Gesto Hospital in Skye. And the Skye Hospital was prestigious because it offered a humongous salary in those days, £270 a year, which in monetary terms today is 27,000. That would be a kind of junior SHO type salary. And again, 65 applicants, he was shortlisted. The guy that built that hospital in Skye was a fellow called Kenneth MacLeod, who emigrated to India from Skye when he was 19, came back 15 years later, a multi-millionaire, and he was an indigo planter. So he endowed the money to get this building in Skye constructed. So he works there for 4 or 5 years, and then the opportunity arises for a medical officer for the slate quarries in Ballachulish back home. So again, with his previous school-time work as a cleric, a lot of people knew him, a lot of people knew the family, but there was still stiff competition, and he got the job. And you'd have thought again that that would be him settled for life. But unfortunately, no sooner had he started the job that he was a very forward-thinking individual who, advocated for the patients. He realized that a lot of the patients lived in terrible housing conditions and things needed to be improved. And so he became quite critical of the quarry management. And there was a standoff, and only a year or two after he was appointed, he was sacked. The strange thing is, although the management of the quarry appointed him, the money for his job actually came from the quarrymen themselves, because in those days each person would have a subscription off their income, and that would be like a club membership, and that would get you your medical care. So they obviously took great resentment that management had sacked their doctor, and there was a big demonstration, very vociferous opposition in the press and in public demonstrations. However, it went to a Court of Session appeal, which he lost. And of course he at this time was coping with the stress of this, was out of pocket. It was then taken to the House of Lords, and again he lost. At that point they were going to take it to Parliament, which I think is the highest level of sort of application, but it was a massive deposit they had to raise. People made donations worldwide in the cause of this because everybody thought it was ridiculous. In fact, Thomas Clouston gave £100 towards the fund, which is quite an indication of his belief in this Lackland grant. But eventually, just before the case finally came to be heard, there was like a thawing in the opposition with the management, and they realized that they were being a bit sort of black and white about the whole thing, and they kind of started to back down. The motion was abandoned, and they came to a sort of negotiated settlement, and then he resumed his position at the quarry. But I'm just going to read you two little letters that went back and forth when this issue first arose, because I think they're quite interesting. One of them is put out in the Oban Telegraph, 15th of August 1902, and it's written more in defense of Dr. Grant. It says, a phase of the case was developed last week when a printed manifesto signed by Colonel Malcolm, he's one of the quarry chair people, was posted throughout Ballaghulish. What makes this document important is the fact that it professes to give the reasons why the company had dismissed Dr. Grant. I'll give the reasons with a few necessary explanations and leave your readers to judge whether they are sufficient to justify the action of the directors. The complaints are two in number. The first contained in these words, which I quote from the manifesto: "If you want to know why the directors are not satisfied with the recent agreement, I will inform you that it is not sufficiently binding to prevent Dr. Grant from taking work on at a distant granite quarry," because he was a real dedicated doctor. He helped out everywhere, away from the neighbourhood and local people that weren't connected with the quarry. "I would ask, why should Dr. Grant be punished because they're not satisfied with their own agreement, under which Dr. Grant was at liberty to take up any practice in the district? Further, I would ask, are we to understand from the above statement that if the company have the power, they will prevent the quarry doctor from attending any patients at the granite quarries, which are only 4 miles away, although Malcolm claims to call this distant? The nearest doctor is 14 miles away from there, and in the event of a case of a sudden illness or accident at Lettermore, the slate quarry's doctor would be prohibited from attending, with the possibility that a death might ensue before medical aid could be summoned from Appin or Fort William. Let the people of Lettermore take note of this. It is a most serious question for them. The second complaint is to the following effect. A clause which was drawn up so that the doctor's address might be known if he was going away got less and less attended to, and the directors felt that in your interest the agreement should be kept. Now, after such an explicit statement, your readers will no doubt be very much surprised to learn that there isn't one word in the agreement about the doctor leaving his address whilst going away. This is only one of several inaccurate statements damaging to Dr. Grant which have been made in the course of the dispute. I am, etc. So, I mean, aside from the profound eloquence of these newspaper letters of rebuttal, which are a great sort of inspiration to us in our use of English. It's astounding that this poor fellow gets removed on the basis of just utterly ridiculous things, being conscientious and being so darn busy that nobody always knew where he was. Things which aren't unremarkable today. But anyway, he gets reinstated and has a very successful practice and does this important work with the quarries, although unfortunately this is taking us to about 1902. The quarry industry is in decline very shortly after, with industrial disputes that get quite nasty, and eventually in 1907 the slate quarry gets liquidated, which is quite sad. Part of it's the sort of world price of slate. The other issue is that it's an incredibly labor-intensive industry. At that time, you had to cut and produce something like 700 tons of rock to get 25 tons of slate. And if there was any pyrite by accident in some of the slate, it made it more likely to pit when it was exposed to the rain. So a lot of imperfections in the slates were leading to slate projections and this kind of thing. So it's the same thing happened in Eastdale. So, slate is quite close to Argyll and Bute and the sort of Highlands near Fort William in terms of money and industry. And being a lot of the houses actually around here, the older houses, have got Eastdale slate on the roofs. So it's thick and has a very good sort of lifespan. So that takes us up to sort of 1907, 1910. Another thing he was very involved in was crofters' rights and the land reform and the idea that people had a right to tenure on their land. But the next big area that this fellow gets involved in is in October of 1912, when there was a committee in Scotland formed entitled the Dewar Committee. And this arose because it wasn't working having these benevolent institutions funding odd doctors in odd hospitals, and medical care was patchy, it was inconsistent, doctors weren't being properly supported for transportation, for equipment, for premises. It was a disaster. So the Westminster government commissioned a division of the Scottish Office to investigate this, and they took evidence from 158 members of the public and over 100 doctors. But the key person who gave evidence to this committee, which in fact was largely what they ended up acting on, came from Lachlan Grant. So the next short thing I'm going to read to you is a kind of brief summary of his evidence to this committee. And let's see. What he said was that there weren't just a detailed list of deficiencies in the system. He had what he regarded as appropriate solutions. And he said that from the medical point of view, there was no security of tenure for doctors, inadequate housing, inadequate income, no access to transport, poor telephone system, inability to afford locum cover, and as a result, no holidays, no professional postgrad training, and the recruitment of nurses as one united organisation was needed, along with plans for community hospital building. All this, he stated, and this is in 1912, should be brought together as one universal state service. So he's the first person that we know of in Scotland who has eloquently advocated what amounts to a national health service. And as a result of his testimony to the Dewar Committee, they subsequently formed a thing called the Highland and Islands Medical Service that came out just before World War I. Didn't really get going until the end of World War I because of funding difficulties. But the blueprint for that was based primarily on this fellow's testimony. And by, let's see, By about 1919, 1920, they had something like half of the landmass of Scotland covered with 300,000 people were funded as a result of this organisation. They had 175 nurses, 160 doctors throughout the whole of the Highlands and Islands. It was administered through the Scottish office, and they looked after locums, holidays, accommodation, everything. So at a stroke, the health of the nation was more consistent, improved, and Westminster were to use the blueprint of this organisation for the creation of the NHS in 1948. And you know, the historians of the NHS don't pay adequate credit to this fellow and the Dewar Committee for that whole process kind of developing and accelerating. Now, I'm not saying that this is the only blueprint they used for the health service, because I think I did read a year or two ago of an interesting area in Wales where they had something similar to what was set up in Scotland as the Highlands and Islands Medical Service. So I think Wales was also very proactive in social welfare provision. But you know, like so many things in life, Scotland leads the way. You know, it's a very special country with a lot of talent, and this is just one example of how they lead the way in healthcare. Just as a sort of personal note with this fellow, it took a lot of time, obviously, to do all this politicking and negotiating, not to mention running a huge medical practice with 3,500 patients. And he was also, you know, the local public health officer. He was the local bacteriologist. He ran his own lab. He took throat swabs looking for diphtheria, tonsils, you know, early syphilis, this kind of thing. He had a TB screening clinic. He actually invented an aluminum throat swab, because at that time a lot of people used various other metals that got tarnished, coloured, damp, and they couldn't sort of get proper samples, but he didn't patent it, unfortunately. And he also, he was a very inventive guy. He had a portable hand washing machine that was like a kind of sterilizing unit, and what it was basically was just a giant square box with a hose coming out of it, and he would put it up 10 feet high on a shelf somewhere if he went to see a patient, so that he could wash his hands under running water rather than wash them in a sort of dirty sink or something else, because he was well aware of the challenges of antisepsis, and he didn't patent it. He said it would be great for vets, great for army flotillas, but it's never known. He had a company, Archibald Young and Sons in Edinburgh, that made this unit, but we don't know, when this book was put together, how successful it was for you know, general use. But it's just an interesting flavour of the remarkable inventiveness and talent of this fellow across all kinds of domains besides medicine. But eventually he married, 44 years of age. He found a delightful woman who was 19, from a solid family, who presumably at that age would do what he wanted her to do. And they had three very nice daughters, one of whom chose to get married. I think at least one of them was a doctor. And then he started to do the ordinary family things, going on holidays and this kind of thing. What's sad is that he died 3 years before the NHS came into existence in 1945. So his kind of thoughts weren't, he didn't live to see the results. But he wrote a vision which was published in 1934, his vision for health, and I'm just going to read that to you as well, because it's, again, very visionary.
Presumably, though, he was aware that the NHS was being born, as it were.
Oh, I think so.
It takes forever to...
Yeah, I mean, absolutely. But this was published in 1934 in an article in a journal called The Free Man, a journal of independent thought. So this is still, you know, 15 years before the NHS is organised. And he says, whatever the faults of the National Health Insurance Act, it must be admitted that has given a great impetus to the idea of an efficient national medical service, and it's certain that a much more comprehensive scheme will be in operation before many years. The advantages of a consolidation of all the present medical and nursing activities are apparent, and that reinforced by equipment and specialization in every branch would give the country the maximum of prevention at the minimum of expense. Every individual, every section of the community would benefit by an organized network of health preservation, disease prevention, just as every corner in the land is served by a post office and the police controlled by a central authority. So would the Scottish Ministry of Health's organisation penetrate to every house and hamlet from John O'Groats to the Mull of Galloway. But no class would benefit more than the womenfolk, especially the mothers in rural, outlandish districts. In some parts, they only see a doctor once every several months. Some mothers with large families have never had medical attendants or nursing. Many cases of hardship could be related, and although some efforts have been made to cope with these under present conditions, it's obvious to all who know the facts that nothing short of a government health preservation system will suffice to fully meet them. Some sections of the country are so poor and difficult to work and would never pay a medical man depending on fees, and it's with many doctors much of their hard work is given ungrudgingly without or with very inadequate remuneration. They're handicapped, they're prevented giving their patients the best that modern medicine knows, they can't keep their appointments and keep themselves up to date. The excellent work of the Highlands and Islands Medical Service Committee is only one example of effort which could more generally be applied in a, quotes, free Scotland. What is wanted is a national system of public health that would provide 1. Medical attendance, 2. Nursing and ambulance services, 3. Medical and surgical hospital accommodation, modern, 4. Houses for maternity cases, 5. Education in health hygiene, first aid and simple remedies. Every parent ought to be so far enlightened in health that dangers due to lack of knowledge will be obliviated. There will doubtless be a special propaganda department under the new regime. Advice and guidance in the form of pamphlets will be conveyed to all and sundry. I mean, isn't that incredible? That's just what happens, you know. Any GP surgery, any waiting room in a hospital, pamphlets are just falling out of the sky at you. The aim would be to inculcate principles from childhood upwards that would prevent wrong habits and other conditions that make for disease and premature mortality. Mother, in the most important sense, is the head of the household, and she would be regarded as a sort of sub-officer of public health in a close alliance with such an established service. It's short-sighted policy that doesn't give mothers the best that medicine and nursing can provide, just because they happen to be poor or living on the country's outskirts. Mothers and children, if patriotism rises to the occasion, will definitely want for nothing but make for the best and highest health and efficiency. All of this in the coming national service will see a reduced infantile death rate, a large reduction in the ratio of children's diseases, more efficient schoolwork, better school attendance, less workers' absence through illness, a decrease in nervous breakdowns, fever cases, etc. And instead of the nurse and doctor being avoided because of expense, they'll be called early. And prompt measures against the enemy would be the order of the day. If every person had to consider fees before calling for the protection of law and police, there would be much more crime to deal with. But the law of the land and the police being a national matter, every citizen feels a personal interest in combating crime, which is only another form of disease, and works in alliance with the forces of law and order. Some critics may say that under such a paternal system, people would flock wholesale to the doctors and worry them with unnecessary calls. But this would right itself in time, and it would be better to have everybody reporting themselves with their more or less imaginary complaints and then discovering the dangerous cases, than that they should hold themselves back and allow infection and disease to spread unchecked. In due time, people would be so enlightened that their imaginary ailments would become a very small quantity. Well, I'm not sure that hasn't happened. And the work of hygienic education would eliminate the stupid notions of the ignorant. That hasn't worked either. The improved health equipment placed at the disposal of the mothers would alone repay the cost of the entire cost of such a service. The constant patrol of the police of public health, or if you like, the missionaries of public welfare, as they might be termed, guarding our homes from insidious enemies, would eliminate a vast amount of material loss. And what's even of greater importance, would dissipate much of the mental depression and moral apathy that weighs so heavily upon much of the people. So it's just inspirational that that kind of eloquent document would come out, 15 years before the health service came into being. And so I do feel that this fellow is sadly neglected as an important contributor to the sort of system that we have today. I think what's sad in public health is that we're going backwards, because especially in England, they've devolved it to local authorities, and instead of it being a unified, organized national system of surveillance, planning and care, it's fragmented. So you're starting to see TB creep back up again in incidents in London. There used to be a national TB register. There isn't. And I think there's a grave danger that public health and infection control is going to be lost in this kind of health and public authority amalgamation type of thing, because I think those of you that know public health colleagues will probably know that they are a very challenged, unrespected group now, that they are employed by the local authority, not by health. They're sort of divorced from the rest of medicine. A lot of them have taken early retirement, and there's a lot of disaffection in that sort of specialty, and I think we're storing up trouble for ourselves, because I think the vision is sound, and I think it's sad that it's being kind of demolished from that point of view. But the other interesting thing is, obviously this country's blueprint for health was copied by many other countries. So they took this kind of success story of the Highlands and Islands Medical Service and then transplanted it in their own countries, especially Canada, but a lot of other Commonwealth countries. So again, a talented man, a spark of an interesting idea in Scotland, and bang, 40, 50 years later, it's going to spread throughout the planet as a kind of concept. So he's my hero.